Hi, my name is Dr. Matt Winter and I am a urological surgeon. I'm pleased to welcome you to this video discussing kidney stones. Treatment of a kidney stone that is causing obstruction depends upon the size and location of the stone. Kidney stones cause trouble when they move into the ureter and they block urine flow. The blockage of urine flow causes increased pressure within the kidney and subsequent pain, possible renal dysfunction, and infection. If your stone is small, less than 5 mm in size, your pain is tolerable, kidney function is normal, and you have no fevers, you'll be able to eat and drink, and we can send you home in the attempt to pass the stone yourself with medications. If the stone is larger, greater than 5 mm in size, stuck within the ureter, or you have severe nausea or pain, fevers, or kidney dysfunction, then you'll need to be treated in hospital. You'll initially require stronger pain medications, intravenous fluids, and antibiotics. Further management will be based on your condition and stone size and location. Spontaneous passage of stones less than 5 mm in size in the distal ureter have a roughly 90% chance of passing by themselves within a month. Larger stones greater than 5 mm are less likely to pass spontaneously, and although conservative management can be attempted, intervention is likely to be required. In this case, an intervention is required to break up or remove the stones. The following procedures are available to either unblock the kidney or address kidney stone related issues. Cystoscopy and ureteric stent. A cystoscopy involves using a telescope to look into the bladder. The telescope is inserted via the urethra. Through the telescope, we can insert a ureteric stent. The function of the stent is to allow urine to flow around the stone which is stuck within the ureter. This allows free flow of urine from the kidney into the bladder. A stent is only a temporary solution to unblock the kidney, and you will require a definitive procedure sometimes within 3 months to remove the kidney stone and stent. Ureteric stents can cause bleeding, increased need to urinate, and discomfort in the bladder and kidney region. These symptoms are very common and can be quite bothersome, but they are not dangerous. Regular Panadol and Nurofen generally alleviates stent-related symptoms. Urethroscopy and laser retrograde intrarenal surgery. Urethroscopy is a common endoscopic procedure that uses a thin telescope which is passed through the urethra and bladder into the ureter and kidney. Urethroscopy is often used to remove stones blocking the ureter and sometimes for small stones in the kidney. We are able to remove the stone via laser fragmentation of the stone into tiny pieces and then use a basket to retrieve the fragments. There is no cutting done on the skin. The scope is passed through the natural orifices of the body, the urethra, while you are asleep. Percutaneous nephrolithotomy, or PCNL. When you have an extremely large or complex stone, this may require a minimally invasive surgical procedure to remove the stone, such as PCNL. It's performed under general anesthesia. A small hole is made in the back and a tube is inserted into the kidney. A small endoscopic instrument is then passed through the tube to break up and remove the stones. The energy used to break up the stone during PCNL includes ultrasound waves or a mini jackhammer-like instrument or a laser. ESWL, or shockwave lithotripsy, is an option for stones 1 cm or less. Shockwave lithotripsy is not as effective in treating large and harder stones. You may require medication to make you sleepy and reduce pain during lithotripsy treatment. ESWL is rarely used nowadays due to the effectiveness of urethroscopy and PCNL. There are a number of factors that must be considered in determining the optimal treatment for you. These factors can be grouped into a few broad categories. Number 1, stone factors: location, size, composition. 2, clinical factors: symptom severity, associated infection, obesity, current medications, what anatomic factors you have, and technical factors. I will discuss all these factors with you, and I'll advise you on what options are best for your specific case. Preparation for surgery. Blood thinning medications such as aspirin, warfarin, Plavix, Pradaxa, and etc. can cause bleeding and should be avoided prior to surgery. I will advise you when and what medications you need to cease prior to the operation. If you are unsure about which medications to stop, please contact the office. Do not stop any medication without a doctor advising you. Diet restrictions. Do not eat or drink anything after midnight on the day of your surgery. What to expect during your recovery. Immediately after the surgery, you'll be taken to the recovery room, and once you are fully awake and your vital signs are stable, you'll be given something to eat. Generally, you'll be able to go home a few hours after your surgery is completed. unless you have a PCNL, which will likely require a 1 to 2 night stay in hospital. You can resume your normal diet. Pain is expected, and you may require pain medication for up to a week after discharge. You may require pain medication for the duration that your stent is in. Medication will be given to you, but you can also take over-the-counter medications such as Panadol and Nurofen to help control the pain. You may experience some nausea related to the anesthesia, the pain medication, or the stent, but this should generally resolve within the next 24 to 48 hours. Fatigue is common and should subside within a few weeks. You may shower after returning home from the hospital. If you've had a PCNL, your wound site can get wet, but must be patted dry immediately after showering. Activity. Taking walks is advised. Prolonged sitting or lying in bed should be avoided. Climbing stairs is okay. Driving should be avoided for 24 hours after surgery, and most patients return to full activity within a day or two following stone surgery. You can expect to return to work within a week after your surgery. If you have a stent or are experiencing significant stent-related discomfort, you may need to take further time off work. What are the risks? As with any surgical procedure, there are risks involved. The general risks of surgery include risk of general anesthesia and possible heart and lung complications. Your anaesthetist will discuss this in more detail. Formation of blood clots in the legs, lungs, heart or brain. We encourage patients to move the legs and return to walking as soon as possible to prevent the formation of blood clots. Death is rare. The specific risks of kidney stone surgery include stent symptoms, pain with urination, frequent urination, burning with urination, urgency, and flank discomfort. Stent-related discomfort is extremely common and can be very debilitating for some patients. Please be encouraged that the symptoms will improve the longer the stent is in and will completely resolve when the stent is removed. Bleeding or blood in the urine is very common, and this can occur anytime from the surgery to up to 6 weeks. There's an infection risk of 1 to 2% in any stone-related surgery. Catheter issues such as blockage or catheter dislodgement, irritative voiding symptoms can occur, and you may be unable to urinate when the catheter is removed. If this is the case, you'll require another catheter in order to go home, and then return in a week for another trial to remove the catheter. A stricture of the urethra or ureter can occur. This may not present for months to years in the future. Injury to the ureter requiring a stent for a longer period can occur, and the need for a second procedure to get rid of all the stones. An abnormal connection can occur between blood vessels in the kidney, injury to bowel, liver or spleen for PCNL procedures only. You'll need to make an appointment with the office after your surgery to schedule a follow-up appointment. Please notify my office or attend an emergency department if you have bleeding in the urine that is getting heavier, not lighter, you develop a fever, or have problems passing urine or worsening pain. I hope you found this video informative, and I trust it has better equipped you and your family to prepare for your upcoming operation. I am available to answer any questions you may have, or you can contact my office if you have any concerns. I look forward to helping you resolve your urological problems, performing the operation, and caring for you during the recovery.